No, you're fine.
No, you're good. Go. Sorry, I'm messing you up.
No, you're good. Okay, so I am Karen Oakes, and I recently opened Tranquil Oaks. I am a licensed massage therapist, and I specialize in therapeutic massage as well as the John Barnes myofascial release. I'm one of 2 people in Pearland that do the John Barnes method of myofascial release. And a little bit about that, it's gentle sustained pressure that addresses the fascia. The fascia is the connective tissue throughout your entire body. It holds you together down to the cellular level. Whenever your fascia is tight, then it will hold your muscles tight. It will put pressure on the nerves. It'll pull the bones and joints out of place. It's very, very important that it's supposed to glide and be smooth, but whenever you go through trauma, when you have surgery, when you have an injury, an accident, your fascia gets tight and creates those problems. So I go in there and gently release it. How I got into it, it helped me. I've been a client of Susan Luna, who's the expert level. She's the other person in Pearland that does it. But I've been a client of hers since after my last child was born in 2017. And it helped me so much. I had back pain that I had even before my babies, and she helped me relieve that. And after, I'm getting nervous. After my last child, it just really helped me. And then a few years later, I had brain surgery for Chiari malformation. And after that, I had the surgery, I was waiting for a follow-up MRI. And I saw a guy in a waiting room, and I could just tell he was hurting so much. And I gave him Susan's number. I never even got the guy's name, but I gave him Susan's number. And he was able to get in that day. She usually books 4 to 5 weeks out. But she got him in that day. And next time I saw her, I asked her about it, and she told me a little bit about his story. He's a truck driver that had been out of work for a few weeks or months, I can't remember now. And if he didn't get back to work the next day, he was going to lose his job. And she got him back to work the next day. And it just hit me, and I'm like, I want to do that. I want to help people like that. So I started massage school, and while I was in massage school, I went through a divorce. And so what I was going to just explore and, kind of not really play with, but, take my time doing whatever, now became my, sole source of income. And I wasn't able to attend the John Barnes classes for a while, simply because it's expensive. But while I was working at a spa, I kept getting requests for myofascial release. And finally I was like, okay, I'm gonna go check it out. I keep getting called to this, I'm gonna go check it out. So I checked the schedule, and they had some seminars in San Antonio that I could drive to, and it was during a time period when I didn't have my children. So I was like, okay, I'm gonna go figure this out. Attended my first seminar, fell in love with it, just like I knew I would. And so I continued to work at the spa for a while, and then in December, it became evident that that wasn't the place for me anymore. Spas are more like making you feel good, whatever. I want to help people. I want to help people get out of pain. I've lived with chronic pain most of my life. I know how it is, and I just want to help people like that. That's my short little spiel. I know it's less than 5 minutes. I beat her this time.
Made me nervous. No. Okay, so that's her story. So we gave her a hand. So we got a question already right off the bat. So we got a lot of questions, I'm sure, for you.
Hey, I just want to say really proud of you. I know
Thank
it's
you.
very difficult to come up and talk, but very interested in, can you tell us about the process of what it looks like? Can you walk us through it when somebody comes and visit you?
So when people come to visit me, I do a pretty thorough intake form. I ask questions back to your birth. If there were complications during your mother's pregnancy, if there were complications during your birth, because your body remembers. Your body holds on to that. You may not consciously recall that, but your body does. And it stores that trauma. And so we go through a very, very thorough intake process, and then we get to work. A lot of times I start with the pelvis, aligning the pelvis, releasing the sacrum, because if your pelvis is off, everything else is going to be off. And so, and a lot of people that have C-sections and gallbladder removal, hysterectomies, hernias, a lot of times that is the cause of back pain. Because if this is tight, you're going to hurt back here. And so I work at releasing that, and then I follow your body's cues. We go where your body tells me to go. It's very gentle. I know the first time I had it done, I'm like, what the heck is this woman doing? I'm wasting my time, I'm wasting my money. It really felt like she was doing nothing. Like, really. But it had such an effect. So, yeah, we just go through it, and usually, like, if it's frozen shoulder, then I'll do the pelvis, and then I'll go to the shoulder. And if one side's hurting, it might be coming from the other side. And with every body, it's different. A lot of times, whenever I'm at networking events, I'm like, let me see your hand, and I'll kind of release their wrist. One lady, I don't think she's here today, her sinus is cleared up. Another lady at the Live to Lead, it helped the hip on the opposite side. So just because I'm not touching where you're hurting doesn't mean that it's not helping where you're hurting, if that makes sense. Yeah, I don't know. Go ahead.
Just hearing this, I already want to do it. I was like telling my wife, I says, I definitely need to go. I had a car accident recently, so I was like, I would love to just check out what you do. So I mean, what is, for you and your business, do you have a web page, or what's the best way to book with you, like you prefer? Because I know we've been having, like, you know, people try to call us on the phone. Or
Yeah. So I do have a webpage. It's just tranquiloaks.com. And I think there's a link to booking there. But there's some glitch in the system right now to new patients aren't able to book for some reason. So just send me a text message. And it's really easy to get me on text message. And then we can go, I just need your phone number, your email address. Then I'll go in there, create your client profile, set up the appointment, and you'll get a confirmation with the address. Right now I'm working out of my home. Like I said, I'm a single mom, so I work out of my home. So I don't publish my address because I don't want everybody showing up at my house. So once you book an appointment, you'll get the address, you'll get instructions on how to get into the neighborhood. It is a gated community. That's part of the reason I feel safe enough to do it there. Instructions on what to wear, because you stay clothed the whole time. I just need loose so that I can get in and touch your skin. And then you'll get another link to the intake form.
Okay, cool. Thank you.
You're welcome. Yes, Dana.
Okay, I have two things. So
Yes, ma'am.
I do want to give the plug. So one of my friends came, she helped me with Live to Lead, and she didn't know what she was getting into when she first started working on her hand, and she was phenomenal. She was just like in awe of things that she did just by touching her hand, and it relieved the pain in her hip.
Mm-hmm.
I wanted to get out, but I was so busy at Live to Lead, so I
That's
didn't have to make an appointment after. But my question to you is, you talk about where you are now, and you just started your business and you're working outside your home and things. So what's your long-term vision? What do you want to see your business in the next few years?
Just a full book. I don't want anything big. I don't want a team of people. I don't want, this huge clinic where I'm doing all sorts of things. I don't want a bunch of employees that I have to manage. I just want to help people. That's why I got into it. That's all I want to do. So my long-term goal, just have a full schedule. Right now I only have about 4 to 7 clients a week because people don't know what it is and they don't know who I am. And that's part of why I'm doing this, even though I'm terrified. Yes, ma'am.
Suggestions increase that number, because I feel like we're all interested now that you said for a second. So I'm like, you just have a QR code and say $15, I'll do your hand right now.
Who wants it? Yes, sir.
So what's the difference between solid and what you do?
So, and I give an awesome massage, by the way, but my focus is more on the myofascial. And the myofascial actually treats the source of the pain. Instead of just making you feel good for an hour and releasing some of the tension, I go to the source of it and release those adhesions and restrictions that are causing the pain. And I'm very intuitive. I think I was working on your back and my hands, I don't know. I don't even think about it, but a lot of times my hands just go where they need to go.
Yeah, she literally landed where it hurt.
So, but yeah, and I release scar tissue, which I said earlier, scar tissue. It's very invasive. It's very, very invasive. A lot of people don't realize that that's what's causing the problem. And so I release the scar tissue. And massage therapy, it's good, and it has its place. But really, if I'm doing my job right, you don't need the chiropractor, you don't need the massage therapist, because I'm fixing the problem instead of just making it feel good for a little bit.
And the reason I'm asking that is because my wife's a nurse, so she's on her feet all day. My daughter, so she's bent over,
Yeah.
so they do the massage basically on a weekly basis, and I'm thinking, well, that's good, feel good,
Yeah.
but is it actually getting to the root of neck pain or back pain? So,
And a lot of times I can do it with the massage too, but with the myofascial, it's different. It's a lot different. Yes, sir? You had your hand up, sorry.
So like I have tense nerve,
Yes, sir?
and I've had it for, not gonna reveal my age, but a long time. And so even right now, I've got that reticulating, it goes up and down my shoulders. And I just kind of learned to live with it. Is that something that you could help?
Yeah. A lot of common problems like the TMJ, the disc problems, herniated disc, plantar fasciitis, carpal tunnel, migraines. A lot of it is just a tight fascial system. And there is no way that they can test your fascia. They can't find it on x-rays. They don't have it on MRIs. It's just the underlying tissue. If you look at a chicken breast and the white layer on it, that's the fascial system. But that's dead fascia. And we need to, the live fascia, it's supposed to glide. So if you look at your arm, glides a little bit that way, but it's a little bit more restricted this way. And it's supposed to glide. I'm not gliding. It's hard to work on myself. Yes, ma'am.
What ages do you treat?
I can treat from newborn until time of death. Yes, sir?
Do you work with veterans at all, or are you a community care provider, or consider being a community care provider?
I've looked into it, but it looks like it's a pretty long process, and maybe that's something that,
Because I'm a veteran, so like I actually got referrals to a massage therapist,
yeah.
and then she can't come back for like 2 years. They're paying her, so. But I don't know if that's something that you would consider, or if that's something that you would.
I've looked into it. Several people have mentioned it, but it seems to be a long and pretty complex process. And I think a lot of times they prefer that people not work out of their houses because, it's a medical thing on the veteran side. So maybe once I get, if I progress to another space at some point, then, maybe I'll look further into that, but I haven't yet. Yes, Noah?
something playing off of that too, what are some of your ideal partnerships to be able to grow the awareness of your brand?
That one's a hard one for me because, like ideally it's like PT, chiro, doctors. I've had 2 clients in the last week saying, why do more doctors not know about this? Because especially post-surgical, I can help, huh?
Because it helps.
It helps, right? And that's part of why I'm like, it's a hard, because I put myself out of business. I fixed them so that they don't need to come back to me. But when something else starts hurting, they'll come back. So I try to talk to the chiros and the PTs, but I'm kind of putting them out of business too. So they may not like me so much.
Realistic, like midwives and
Yeah.
doulas and building partnerships with them. that realm.
You're right.
Their clients are already people that are thinking a more holistic route anyway.
Right, yeah. And Susan Luna has developed a big practice treating children, infants with tongue tie, with trouble latching. So doula found her, and they recommend her to all the mom groups and everything. So,
I have a question.
yes, ma'am.
So about how many treatments, like how many, and I know everybody's different, I know.
Yeah.
You just said, but like about how many treatments, like you said, basically I treat someone, I fix them, then they don't come back. But how, average, like would I have to see you 2 times, 6 times? Like how many times normally fixes issues?
So I've treated 2 frozen shoulders that I relieved in 1 session. Another frozen shoulder, I've seen her 4 times, and she still has some restrictions. So everybody is different. And a lot of times, whenever I release one area, another area starts screaming. They're like, that doesn't hurt anymore, let's go over here, Just because your awareness is no longer drawn to that, it can go someplace else. So usually in about 4 sessions, we can knock it out. And the more frequently I treat you, the faster it will go. Because you don't have the time between sessions to clench back up, to get those compensations back in place. And it's already softened, so I can go deeper faster. So usually if I don't relieve it in 1 session, come back in 1 week, 2 weeks max, and then we can keep going. Sorry, yes.
You mentioned your awareness of the trauma that that your clients experience.
Yes.
Can you speak a little bit about what's your approach from that perspective of knowing that you're treating trauma?
I don't really know. So whenever I'm treating people, a lot of times emotions come up. Sometimes the body goes back through that traumatic event. I just hold the safe space for you to re-experience that. And you need to re-experience that in order to release it completely. I just sit there, hold you, wherever we're doing, and if you get too, active to where I can't, but I always try to, keep some sort of contact. I had a lady relive her childhood abuse on my table, and that was very emotional for both of us. So, and everybody's different, of course.
Appreciate it.
Of course. Yes, ma'am.
How long is the session?
I start at 60 minutes. I do up to 2 hours.
What would you say is your biggest challenge right now in business?
Finding clients, getting I'm not a public speaker. I'm just a mom trying to help people. So I just finding clients, finding those referrals. So I post in the Facebook groups, like Talk of Pearland, Moms of Pearland, on the free marketing days or whatever. Then I have a little flyer, a little bit about John Barnes, the conditions that it helps, a little bit about what I do, and then I'll post that. Yes, sir?
Have you done next door at all?
I have not. I have not.
Especially your services.
I just shared to your phone. There's a group called South Houston Moms. We did an event with her last year. Huge following.
Really?
That could be something very attractive to them.
Yeah. I've gotten flagged a lot in the local groups because a lot of them say no self-promotion, but nobody's out there promoting me because they don't know about me. You have the Jasmine Journey, all of her employees, and she offered me a job twice. But all of her employees, anybody like, hey, we need a massage, then all of her employees go on there and recommend her. Everybody suggests Jackie Cardona. Everybody suggests Susan Luna. And I just get lost. I'm just like, hey, I'm over here, So.
That could be something too, where would you travel to let's say a company and do where the company pays for the whole day?
I could do that, and I have back problems myself. So in my room at my house, I have a hydraulic table to where I can adjust it to my comfort, because sometimes the holds I do are very long. I can hold this position for up to 30 minutes. So I need to be comfortable. And so yes, I can go, but a lot of times they're looking for a massage, not the myofascial. And right now I'm like, any money makes good money, I guess. But yes, I can and will do it.
That could, I mean, yeah, you're gonna focus on that, but the massages at those companies can expose you for the other.
Yeah. But that's part of the problem that I had at my spa job, is because they wanted me to do massage. So people would come in and they're like, this hurts. And I'm like, let me sneak this in, you know? And then they'd leave and they're like, I don't feel like I got the deep tissue. I'm like, but you feel better. So, yes, ma'am.
Okay, last question.
First of all, thank you so much for sharing your story.
Of course.
And my question about like marketing and promotion, because I'm always looking for like partners, you know, like have you tried Pilates studios, you know, already thinking like how like we can help you, you know, like have you tried working with them, because I believe they concentrate sometimes on the pain, because like people trying, you know, like to get rid of like different, you know, like pains in the body through Pilates, you know, like and probably, you know, like it may be additional, you know, like resource for Pilates students to have you as a part of the process. Have you thought about it? Or?
We talked a little bit about it my first week, but we haven't done anything with it yet. But that is a good
Did you
idea.
have one?
Yeah.
It's not a question, it's really a suggestion, because I know I've seen your posts like on the different groups, and I'm always like, yes,
Yes,
great, you
do
know,
it.
because obviously, you know, people, like, you need validation and all that, so. Have you considered, instead of doing, like, I do Barnes, or, I don't know.
John Barnes.
Yes, I do that because, like, we don't know what that is.
Yeah, yeah.
And so, talking about it in a way where it's like a storytelling. Like right now, you told us everyone's interested because we understand it now. Because you brought it to a level where you talked about how it shows up in our life. So then, when you post it, instead of saying, I do this and these are the you know, help with back pain, I help with migraines or whatever. Although, yeah, I have migraines and I see it, it's just, it goes over my head. But when you talk about how it shows up in their life, right? It's different, it hits different. So
Right.
like, it might also get you through the whole like promotional thing, because you're not technically promoting, you're just sharing a story. So like saying something like, you know, I love what I do, and the reason I do what I do is because there's people like, make up a name, you know, who she came in because she couldn't pick up her grandkids, and she couldn't do this, and do this, and do this, and then mention everything of how the issue you're helping her solve shows up in her life, and this is why I do what I do. So then the person who relates to those pain points is gonna be like, wait, how'd you help her? And then they're gonna reach out.
Right.
You didn't promote, right? So they can't be like, hey, you're promoting your business. You're not, you're sharing a story.
Yeah.
And that really helps people understand, like, not just what you do, but like how it helps them. So just a suggestion.
No, that's a good idea.
Yeah.
Thank you. Okay, so we are at our 15 minutes.
Very quickly, it's a compliment, it's a compliment. I first met you at Vanessa and Miller's event in December, and I sensed your hesitancy with just being in that small personal group. And to see you from just December to today and how you're standing up here telling your story, you just, I feel like, have grown so much.
Thank you. Thank you. Thank you.
Sure. Okay, so one last question. How can we as a community help you?
So whenever people post on Facebook in those groups saying, hey, I have carpal tunnel. Hey, I have migraines. Hey, you know, my C-section scar is bothering me. Those things, recommend me, you know. Be my Jasmine Journey employees and recommend me.
All right. Thank you so much, Karen.
Of course,
That was
thank you.
great.
Thank you.